one of the biggest debates in this opioid issue is how to treat people without using opiates. And joining us is Dr. Raj Due from Johns Hopkins Orthopedic Sports Medicine Doctor. Thank you for coming by. You've been in the game for about 15 years, but you've seen this whole debate change over time. What do you think, how's pain changed, I guess, for patients these days?
I think, over the last 20 years, I think that there's been a big emphasis placed in medicine on treating pain and treating pain appropriately. And, I think that, for example, when I was a medical student, there was, this big push to add pain as a vital sign, and they used to call it the fifth vital sign. And so, you do your blood pressure, your pulse, your respiratory rate, your temperature, and then add the pain score. And I think around that time, hospitals started pushing to treat pain a little bit better. So I think physicians started using more opioids during that time period. And I think also, the opioid manufacturers were marketing it more. These are great options to help those individuals that have that chronic pain. As a result, it kind of grew, and more people, I think physicians in particular, got comfortable prescribing them. Sure. And then unfortunately in the beginning you don't realize what the harmful effects can be, but then 20 years later you see the epidemic that's going on.
Tell me about your practice, because you take the option of really not doing much with opioids. You have some other strategies.
Yeah, so I see people and patients that every day are coming in with a complaint of some sort, be it shoulder pain, elbow pain, knee pain, hip pain. And so, the way I look at it is I look at kind of the type of injury and how extreme it is. So for example, if somebody comes in with an acute fracture, well, that's going to hurt a lot. And initially for the first 72 hours or so, they're going to have a lot of pain. So I will prescribe opioids for that. A lot of times what I do with folks is, I do a lot of injections. I feel like injections are more localized to the source. So, for example, if you have a shoulder injury and an injection would be appropriate, I think you treat the source in that. And I spend a lot of time trying to get people into physical therapy, just because, if you treat them with just a medication alone, that's just a Band-Aid. It's not like they have an infection, you can give them an antibiotic and you're gonna kill the infection. When you're treating somebody with a pain medication, there's something underlying. And if you don't go after what the underlying source is, then that's where it's going to be a chronic problem, and that's where the individual is going to need continued medication. And so I think that's a big thing that I push is getting individuals into doing some type of rehab so they can turn everything around.
Okay, Dr. Raj Due, thank you for coming by. I appreciate it.
Trust your instincts, trust your gut instincts. If it doesn't seem right, it's not right. Question your child, and above all else, do not worry about whether or not you're going to upset your child or make your child angry.
She lost her son to opioid misuse. This mother's message to other parents who may be suspicious their child is headed down the same path. Do you or someone you know need help with addiction? Call our hotline. We have volunteers ready to take your call. That number is 410-261-2300.